Hi, Rupa Health. This is Dr. LaKeisha, your international and celebrity menopause whisperer, Oprah's own TV network featured perimenopause and menopause expert. Today, we're going to talk about 5 ways to glide and not slam into the pause. Perimenopause and menopause, that is. I actually refer to them as ways to biohack perimenopause and menopause. And so let's go down the 5 ways. Number 5, become a perimenopause menopause mythbuster. Number 4, help your patients know what tests to run or know what tests they need. Number 3, know what vitamins they need to have during this time in their lives. Number 2, learn about the gut hormone connection and know if BHRT is right for them. Become a perimenopause menopause mythbuster. Oh, this one here is where I tell people all the time. Perimenopause and menopause is not solely associated with an age number, because women are told all the time, you're too young to be in perimenopause. You're too young to be in menopause. What menopause and perimenopause are, it is the cessation of the cyclical rise and fall that happens in a set interval. And for menopause, it's where that cessation happens and it causes a cessation of your cycle for 12 consecutive months. Perimenopause is the time around this. This is where I tell patients, unfortunately, welcome to purgatory. Because perimenopause can last 5, 7, 10, 12, 15 years before you go into full-blown menopause. Perimenopause in the textbooks as well is known as where there is a shift in a woman's cycle by about 7 days, plus or minus, which means your cycles start coming closer together or they start coming further apart. What I really want you to be able to nail down and take away from this particular point is helping your patients understand this is a physiological process that is happening. It is not solely based on your age. It's not just because you're X amount of years old, oh, you go into menopause. No, it is the cessation of that cyclical rise and fall that happens in a set interval. The other thing is that a lot of women even feel like they did not go into menopause because they didn't have certain symptoms. They didn't have hot flashes, night sweats, or vaginal dryness. That's only 3 of over 100 different symptoms that can happen during perimenopause and menopause. So I have patients that will say, oh, I never went through menopause. Yes, you did. Because menopause is the cessation of your cycle for 12 consecutive months. Just because you were spared the intensity of any symptomatology that was surrounding that, it does not excuse you or exempt you from going into menopause. Menopause is a phase of life. That's the way I see it. And I actually stopped using the term postmenopausal because I started getting a sense that women were feeling as if when they got through menopause, they were going back to an old self. They're in a new body and they need tools on how to wrangle this new body. So remember, help them become a perimenopause menopause mythbuster. It's not just an age. It is the cessation of that rise and fall, that cyclical rise and fall. And there can be a variety of symptoms that can evolve from perimenopause to menopause, and their symptoms can change even. They can start out with one set of symptoms and then another set comes up, or they can exchange one for another one. So helping women understand that is very, very powerful. Biohack number 4, help them know what tests they need. I have women come to me all the time and say, my doctor won't test my hormones to see if I'm in menopause. And once I kept hearing that, I said, oh, I started asking questions. Do you think that there's one test that needs to be run, that there's the menopause test? Oh, yes. Isn't there a test for menopause? and I started helping women understand you are a big bag of hormones. There's so many of them. And so there's no one test. And we have to help them understand their different modalities of testing. So there's the traditional get serum tested or blood drawn. So you go to your drawing station where most people are familiar with. They get their blood drawn. It tells us what's floating around in the bloodstream, what is available. There's urine testing, the dried urine testing that's done to look at metabolites, to tell us what went from the bloodstream into the cells and created a reaction that spit out metabolites on the other side. There's saliva testing. This can tell us what's bioavailable at a certain time of the day. And this can be helpful for various different situations. So knowing and helping women understand that there are different ways to test and there are different tests that we do run to get a total picture of what's going on during this phase of life is really what the tests are. So you tell them that they can test for sex hormones. So that can be their estrone, estradiol, progesterone, total and free testosterone. There can be serum testing around cofactors that are needed, vitamins that are needed to help these reactions to be as efficient as possible. There is the saliva testing that we can do to look at various different levels of hormones during the day. So helping them understand that there's not just one test. And we may need to test various different systems at the same time. For example, not just looking at the sex hormones, but also looking at the thyroid gland, also looking at some of the signals that come from the adrenals to be able to be helpful and tell us how to get a bigger and more total picture of that person. So helping them understand there's not the test for menopause. Biohack number 3. Do I need vitamins or am I just making expensive urine? I love this question because helping us see that chemical reactions need cofactors, need vitamins and minerals to help the reaction to operate at its highest potential is what this section is all about. Yes, some people can use a whole lot of different vitamins and it not be targeted. This is where you can help them target certain reactions so that they can get an optimal result. For instance, when it comes to estrogen detoxification or helping their body to change estrogen into the various different forms so that the body can get rid of the one that it doesn't need anymore, taking DIM, diindolylmethane, or sulforaphane, it can help at different stages of the detoxification process. Also, taking beta-glucuronidase can also help at a certain phase during the detoxification phase so that you can help with the end phase, with phase 3. Taking selenium can be helpful for making sure that the liver and the thyroid are functioning correctly. Taking magnesium can be helpful for brain chemistry to help progesterone so that the whole cascade of events can happen so that a person can have that more restorative sleep and get to sleep better. So making sure that the vitamin choices are personalized is very, very important. And this is where you sit down and you have a conversation and you tell them there are some tests too that can help us to see, are you deficient in certain minerals and certain vitamins that can be very helpful while we're putting together this personalized plan. Biohack number 2, understanding the gut hormone connection. So now we've talked about putting certain supplements in the system, making sure hormone levels are at an optimal level. But now we have to make sure that this part of the system is working at its best as well, because there are certain bacteria that need to be present in order to create a favorable environment for the breakdown of hormones and the reabsorption of others. So making sure that the gut microbiome is in the right proportions, has the right ratios, has the right bacteria in the right neighborhood, as I say. So making sure that bacteria that doesn't belong in the small intestines has gotten down to the large intestines, and bacteria that should only be in the large intestines hasn't found its way into the small intestines. Because we can do all this wonderful work for our patients, give them the best personalized plan, but if once we put all of this into the system, there's no clear path for the system to get rid of it, it's all null and void. So this is where if your patient's gut is not healthy and is not the best, you'll do all this wonderful work. They will feel great for about 2.5, maybe 3 weeks. And then they're right back to where they started. And they're like, what in the world? I don't feel good. I actually maybe even feel a little worse. So helping them understand there is a gut connection between the bacteria makeup in their gut and their hormone metabolism. This is where I say you may need to even have the conversation about a GI map, about looking at the gut microbiome, utilizing a test that you like to be able to evaluate that. So it's not just let's look in the blood, let's look in the serum, let's look at the dried urine, or look at the saliva. Let's look at the piping system and look at the gut as well. Okay? Biohack number 1 is BHRT right for you. This is a big conversation to start and have, and it's an ongoing conversation. This is where we have to put context around the hormone arm of the WHI initiative, or the Women's Health Initiative. The Women's Health Initiative studied synthetic hormones. And yes, there appeared to be some adverse outcomes to that hormone arm. For one, it appeared that there was an increased risk in breast cancer. When that data was reevaluated here recently, it showed us that there was no increased risk in breast cancer above a woman's baseline. And that's important, because now we can have the conversation without having the scare of, am I giving myself something that will cause breast cancer? The other part is that the WHI used synthetic hormones. They use conjugated equine estrogen and progestin. What we have available now are bioidentical hormones, and there are different ways that they can be administered. There's transdermal, there's injectables, there are creams, there are patches, there are pellets. There's an array of ways that you can administer bioidentical hormone therapy. The big thing that I really want you to be able to communicate to your patient is that bioidentical hormones look just like biological hormones. It's the same chemical structure, which means the body looks at it, takes it in, and goes, I know what to do with this. I know how to break this down. Matter of fact, we have these cofactors here that can help this reaction. We can break this down into its metabolites and get rid of the ones we don't need, so that nothing hangs around and can cause DNA damage. So have this conversation with your patient. Tell them what is available. Tell them how they can incorporate this into their lives, and give them the updated information so that they can make informed decisions. Because I always say, if you've seen me on here before, I always say an informed refusal is just as important as informed consent. So here are 5 ways that you can arm your patient to glide and not slam into the pause. So help your patients know where they are in the other PMS. That's perimenopause, menopause survival, and help them live. It has been my pleasure to be here with you here on this platform again today.
Welcome to Root the Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.